Thank you. Good afternoon, everyone. My name is Hina Khan, and I'm a physician and a medical oncologist, and I'm also an East Greenwich resident. So I speak not only on behalf of my fellow residents, but also as an oncologist who studies, and my major work is in environmental exposure and the effects of carcinogens that we didn't know of, and some of which we know of now. So, I would just like to give like two second overview about Rhode Island, why it's special. And in the past 10 years, we have done several data analyses based on national registries. There was initial data analysis from 2002 to 2006, which showed that bladder cancer incidence in the state of Rhode Island have been one of the highest. It's compared to 37 versus 53 out of 1,000 cases seen in Rhode Island. And similarly, over the past 5 years, our group has looked deeper into these statistics, and Rhode Island continues to stand highest in incidence of bladder cancer in the country. And while we're working on the research on why this is happening, a major part of this is, which we already know, is bladder cancer. It's textile industry and metalworking industry has been implicated in the dyes, solvents, the metal dust, and a lot of the carcinogens that are released into the water and air are eventually the cause of it. And not trying to just talk about the medical complications, but also the financial burden. The annual economic burden in the state of Rhode Island to treat bladder cancer is close to 22 million. So it is a pretty significant burden. And then in addition to that, we also worked on looking at the effect of radon in the incidence of lung cancer in the state of Rhode Island. And radon is one of the highest, Rhode Island is one of the states with the highest levels of radon in the soil. And again, these are two things that we really didn't know of. And in the past 5 to 10 years, we really come to realize that, in fact, these were harmful gases and harmful chemicals that were released, that actually we're seeing the effects of them now. So going back to the technology, so MedRecycler, the technology that they claim to use, is supposed to be pyrolysis, and all of the literature, if you read up nationally and internationally on pyrolysis, is really on non-medical waste. And the caveat really for processing this non-medical waste is that once they produce syngas, which Kevin Burdiss really nicely talked about, once the syngas is produced, it's really supposed to be scrubbed. So the syngas scrubber produces this pollutant-free exhaust, which is, if in the ideal situation, when it's really scrubbed well, that happens. However, if you talk about research that has been done in this area, the Iowa State University and several other environmental researchers have claimed that gas cleaning technologies are still under development. So whatever technology MedRecycler claims to use, it's still not been well tested, and we don't know. Syngas contains methane, carbon monoxide, carbon dioxide, in addition to several other chemicals. And again, please don't forget the medical wastes. Being a physician, I know that medical waste contains human waste, body fluids, tissue, blood. It contains plastics, which certainly burning will produce, we don't know what all. And then, of course, infectious waste that was pointed out as one of the speakers, culture dishes, vaccines, contaminated materials, all of this will go into that, and we do not know how and will this technology be able to clean and disinfect. Again, everything ends up in our water and our soil. So not only as a citizen, but also as an oncologist who is trying to really work on reducing the environmental exposures, I urge the DEM to strongly consider this, and I will be sending my written comments as well.